Thanks so much for watching Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields. I'm joined by my co-host, Dr. Apoorv Gupta, and today we are welcoming Dr. Daniel Gordon, who is founder of a private clinic in London. Thanks so much for being here.
Thank you for the invitation.
Why don't you start by just telling us about what you're doing in your clinic? You used to work in the public system and then you transitioned to founding this company in January of 2022 outside of the public system. What led you to that decision?
I've been a doctor for many, many years in the UK, probably around 15 years now. And I've been through the public system and done my training and really, really value that kind of healthcare. But what I started to notice is that specifically patients' interactions with the system and doctors' emotions within the system, burnout, mental health difficulties, physician attrition, so doctors kind of leaving the country or leaving the profession was really, really high. And I noticed with myself that I guess my vision of medicine from when I had graduated and beforehand from when I applied to medicine, it wasn't really matching up to my reality, even allowing for that kind of naive gap in reality that you're expecting necessarily. And so I kind of set out in 2022 to create a clinic that aligned with my values around delivering. The way that I described the clinic was kind of old-fashioned general practice fused with modern technology. So it's not that we only use AI, use digital consulting, or we only use certain medications. We do that, but we do that with old-fashioned family. In here we call it general practice, but I know family medicine in the States. And I'm trying to fuse both of those together to create a clinic which is led with compassion, where patients feel like they are heard, they're listened to. That's one of our core values, is that people feel listened to, that people don't have to fight for their health, so that they're not having to call up 15 times to get something basic that they need, and where customer service is at the absolute highest point of everything we do.
That actually, I should have mentioned that at the beginning, that the way that I found you was on LinkedIn. Somehow you popped into my feed and you had this post about the importance of the doctor-patient relationship and how you need to become connected, not separated from them. And you said something about in medical school, you learn nothing about that, or you learn the opposite, to protect yourself, to keep yourself separate. And then you have a fundamentally different belief, which is what we talk a lot about on this show, that is going to reduce burnout and reduce the cognitive load. And so what led you to that? Did you go into medical school hoping that you were going to find that? Or were you disillusioned when you went through medical school and then started that system? So what got you to the point that you somehow managed to resist through all of your training the idea that you should remain separate?
I don't think it's about resisting. I just think it's about that it's hard to find necessarily role models. And maybe that's also a personal thing. So there are probably many doctors who see things the other way, and that's fine. But I think my value system was very much about caring and and I struggled through my training because, and I think one of the reasons is also the fact that when we have a placement-based training system, probably similar to you. So you're going through these placements very quickly. You don't get attached to any patients really. You don't get to see anything through for very long. And then actually, for full transparency, I had aimed to leave medicine and go into kind of consulting and to go into some corporate work. And then I trained as a family physician with the aim of leaving with a qualification. In my final year of my training program, I was placed in a clinic with an absolutely superb doctor who was in England. We have a family physician to train by an individual doctor, an individual GP. So he was responsible for my training for a year, and I spent a lot of time shadowing him, discussing cases with him, seeing how he worked. And there was this kind of a light bulb moment which came over time, which was like, hey, this is a totally different way of doing things. I saw him going to patients' funerals, dropping off kettles at the houses of patients who were neglected themselves and couldn't make a cup of tea. And knowing that his patient medical history is like, there was no patient that you could not mention to him that he'd not seen in like 10 years, that he couldn't recount their medical history from 10 years ago. And I guess something about that hit that part of my brain, which maybe that was what I expected getting into medicine in the beginning. And And that's when I think I probably really started enjoying the career.
That's remarkable, Danielle, and it's amazing as I hear your story how much it's similar to what we hear about from doctors in the U.S. and other parts of the world as well, in terms of what they're going through. You know, the disillusionment that we face as we come through medical school and residency and training, and inevitably, then many people here and again throughout the world, unfortunately, are burning out, leaving the profession. So it's
Yeah.
great
And
that you
physicians need to be
recognize.
really careful what they say to their trainees. And there are ways to say things. I remember being once in a clinic as a medical student, and I was just having a bit of a rough day, and the consultant was sitting there just saying, you need to have a backup plan. You need to get out of medicine. Get yourself a property portfolio, and I guess the messages are not bad, as in, actually in terms of, think of other financial means and think of other ways to structure your career. But saying that to an impressionable young medical student is really, really harmful. And those things sit with you. And, we heard a lot of that talk as medical students and as junior doctors. And, it builds over time. So I think physicians, surgeons, we all need to be very careful about what we say to idealistic young doctors in training.
It's so true. And yet you found a mentor who sounds like that mentor changed your life. And the one thing that was striking me, although I do want to focus more on the private clinic part of what you're doing, but the one thing that struck me is potentially that mentor was in the public system. Is that correct? And
Yeah.
if so, how was that person able to do what they were doing? And do you believe that now it's no longer possible to practice that way in the private
I
in the
think there
public?
are some people who I think there are some people who would always practice in that way, but I think the problem is it comes at a significant personal cost. You give of yourself over and above your pay, and you may tolerate certain conditions, but it's really difficult because the person we're speaking about is very, very unique. But I know a lot of doctors kind of my generation who do really want to deliver that kind of care, but they just get to the end of the day and they're exhausted and the system's changing and the demands are high and the number of clinical contacts in the day are high. And then when you finish your clinical contacts, you have your administration and your repeat prescribing and all of these things. And you either have to decide to make that decision between staying on till 10 p.m. or going home to your family. And either way, you're letting someone down. You're letting your patients down, or you're letting your family down. And I think that's why a lot of people in my generation specifically are really trying to reconsider how they are relating to their careers.
How can you encourage people who are in your generation of doctors that their training may not have been the best way to deal with patients and that there is a more fulfilling way? And you said you're seeing really great results within your own clinic for both patients and the providers. So what are some of those ways that the way that you choose to practice medicine, the way that your mentor showed you, is beneficial to the system overall?
That's an excellent question. The truth is, I don't know the answer, but I think you have to lead by example. I mean, I think, yeah, I get a lot of doctors, GPs reaching out who want to work in my clinic, and I try and meet all of them if I can. And one thing they're really, really surprised to hear, and I see the look on their face, is when I tell them I really enjoy my job and I really enjoy my day. And I love the fact that I have to go out on weekends sometimes to see my patients because I don't consider it a strain. When I know the patients well, we have a good relationship. I know that they'll only call me out if they actually really need it, usually. And so when I see the surprise on their face, I think it's important that we do show people there's a different way of doing things. And, we in England, ultimately, the way we learn medicine is very much the NHS. It's very much the public system, and again, this is not about NHS versus private. This kind of care exists in many, many places in the NHS. But if you're in specific departments or specific areas where you haven't experienced this kind of care, then it's about, I think, leading by example, ultimately.
I love that answer, actually, Daniel. Right now, we don't have all the answers, but what we do know is how we're experiencing it and how we feel. And if we can feel good about what we're doing, then that's a great example to set for others who will then
Yeah.
emulate that.
And I,
That's
and I want to emphasize that it really isn't about NHS versus, I've worked in private clinics where it was, patients felt not listened to, not heard. There was poor patient there was physician burnout, and I've worked in NHS public health departments where there was compassion, understanding, absolutely fantastic patient-doctor relationships. So it's not either or; it's the leading by example.
Well, that's a perfect segue into what really wanted to dig into with you, which is, so what is the secret to making sure you're listening and delivering care with compassion? How do you make sure that that's being done in your clinic?
So, I think from my perspective, it's leading with customer service, and I think customer service is sometimes an ugly word in healthcare. I think that we sometimes have an idea that we shouldn't have to give customer service because we have demands and we're busy, but customer service is one of the best ways that people feel listened to and heard and understood. I mean, if you were going out and buying, a new oven or a new car, um, the way that you are made to feel in that store will really, really shape many things about your relationship with the purchase, about your relationship with the business, about your future customer, the business, the way you feel about yourself. Um, and we forget that in healthcare. So even so, from my perspective, everything starts with positive customer service, and that doesn't mean you have to do everything people want whenever they want it, but it means listening, compassion, trying to answer people's questions, having someone who can speak to someone on the end of the phone quickly, doing something if you say you're going to do something. Um, these things all lead the way, and I think unfortunately customer service in healthcare has been really lost across the board. Across the board. And, I've got patients that I've referred to world-class leading surgeons who can't get through to anyone, have cancelled appointments. They don't receive a letter for 2 or 3 months later, the clinical letter after their encounter. And, that leaves people feeling lost, kind of misunderstood, not listened to. So for me, that customer service point is the most important one, both from physicians, clinicians, and the administration team.
Do you have a mechanism to train people then in that way? Like, is again, you didn't learn that in medical school. So I guess I'm curious to where did you learn that? Did you develop your own system? Did you have to go to some other training program to do it? And have you
No,
devised a mechanism by which you train all your staff and colleagues?
that's a really good question. I've never actually thought of it. And no, I kind of made it up, but I think I made it up from my knowledge of medical leadership and management, my knowledge of people, but specifically my knowledge as a family physician. As a general practitioner, one of the things we're taught most to do is to care and to listen, and about our communication styles, because it's not so simple. Many presentations we see are complex and require complex communication and making people feel calm and listened to. And you see how much better the off your patients when they have that space. So I guess I just wanted to bring home to the business a similar kind of philosophy. And I guess I'd also seen how people take that away, their interactions with you, and often really, really they will spread that, they'll spread that love that they feel around. And so in terms of patient recommendations and word of mouth referrals, you just kind of see the effects of that. And that's not through you can't do that by, it's not really possible. So I think I made it up is the short answer to your question.
I love it.
I think it's interesting because you were just saying what you were saying just now sort of reminds me of what you were talking about in the pre-interview, that when you provide love and compassion, that it comes back to you in all of these different ways. So why don't you tell us how you've seen that? And were there any unintended or unexpected benefits that you've seen, or, patient stories that have really stuck with you through this model that you've had, and give you that validation that you're doing the right thing and you guys are making a difference in the lives of the patients and the physicians for their quality of life?
Yeah. So, I can't talk to individual patient stories, but I think what we see is we see a huge, huge amount of word of mouth referrals. I mean, usually if we take on a family member, like a new patient calls us, within 6 months to 1 year, we usually have taken on the whole family. Um, we, we've really moved into wider networks in terms of other businesses we relate with as well. Um, for me, I think it's probably in the physician satisfaction and in the word of mouth referrals as well. That's where we see That's where we see it's very difficult to say outcomes because obviously you'd have to then track, does someone do better with or without this kind of care? And I think it would be really anecdotal. I mean, it would be too difficult to do a scientific study on it. But I know that, I mentioned beforehand, we have a huge amount of 5-star patient feedback on our website, which is none of it is specifically solicited. Everything is just, all patients receive automated feedback emails, and they leave kind and well-meaning and often very detailed comments about their experience, often with personal, insights into their own health and well-being. So I think that particularly is a good example of that kind of love and compassion kind of flowing back towards us as well.
What in your background led you to this point? Was there something growing up or some impetus in your life that you were like, this is what I want to do, and made you feel like you wanted that connection that you might have been missing whenever you were going through medical school and having those hard moments? What kept
Oh,
you going? Is there an anchor point in your life that you were like, that's what it is. I have to fulfill that?
no, no, I was terrible at self-knowledge in that respect. I think I've only realized it in the last. I think I had to do it before realizing it was what I wanted to do. So I tried many things. I applied for many specialties. I specialty switched a lot in my training, anesthesiologist for a while, which I loved, but it was missing something. I applied for another training program in OBGYN, and I didn't get that, which it honestly was probably the best thing that ever happened to me, because I think if I'd have taken that, I'm not sure I quite would have been where I wanted. And then, as I said, I investigated leaving medicine for a while. I think I had to do the rounds, um, and just see the world, so to speak, before settling on something where I felt that was my fit. It took me longer than I think it takes others, but I got there.
So where within you does that, fundamental belief that this deep level of care and connection has to happen? Because it really is something that very clearly comes through looking at, your LinkedIn page, the passion that you have. So where does that fire come from?
We're getting very deep here, and the truth is I don't know. But when you were talking, it reminded me of something that I kind of say to my kids is, when they're kind of teasing each other, or when they're discussing conflict with their friends, I just kind of say, you have a certain amount of energy that you can use in a day, and you can expend that on making people feel not very good about themselves, or you can expend it on making people feel good about themselves. And what I've seen very much, and I guess it is an experience thing, is that I think there's a lot of really difficult stuff out there in the world, and I'm often in awe of my patients, and they go through stuff that's just shocking, sudden diagnoses of cancers in children, traumas, injuries. And if we can make that a little bit better, and I think we can, then why wouldn't we? And it's very easy. It's so easy to give people a negative interaction, but it's also easy to give them a positive interaction. And I guess that's what I'm trying to um, that's why I was quite interested in coming on the podcast, because I don't think any of this is actually that hard. It doesn't take that much effort, and it doesn't cost that much more. It probably doesn't cost anything more, but it's easy to do, and I think it's a basic human thing to do. And I'm very interested. This is a little bit of a segue, but I'm very interested in just the way that we explain things to people and the way we discuss things to how different it can have an outcome. So if I'm prescribing someone an antidepressant because I really feel they need it, I think a lot of doctors will say, I'm going to start you on this medication. Just so you know, 1 in 10 people get a headache. 2 in 10 people can feel more suicidal in the beginning. If you have any problems, you might feel nausea, you might feel vomiting, you might feel this and that and the other. Any problems, call me. Whereas there's another way to say it, which doesn't involve lying, by the way. It doesn't involve hiding information, because that's really important as well, because you have to make people come to an informed decision. But you can lead by saying, listen, I'd like to start you this medication because I think you really need it. I want you to know, before we get into things, I have given this medication to a lot of people before, and I've seen them do really well with it. And I think you're going to do really well with it. Okay, I think this is going to make a huge difference in your life. Here are the things you need to know about it. So it can in the beginning transiently increase your feelings of anxiety, depression. And what I'm going to do is I'm going to put a call in the diary in a week's time. I'm just going to give you a really quick call to check in and see how you're doing, but you know where I am. And both of the ways you can include the scientific information, but the way that the patient feels and buys into you as a clinician and your management plan is totally different either way. And I'm fascinated by the difference we can make with that communication.
Wow, that's remarkable. I love that story, Daniel. I'm so glad you went into some of the details of it because we talk a lot about evidence-based medicine and how it's wielded sometimes as a weapon. And a lot of physicians feel like this is what I've learned, this is what I've been trained at, this is the research, and I'm just going to tell people what it is. And that unfortunately it winds up becoming a very blunt weapon because a lot of patients can get harmed by the way in which that information is being received, as opposed to the way, again, you're presenting the same information, you're not manipulating it, but you're presenting it within a sphere of wanting to make sure the patient understands it and with compassion and with hope and optimism, which are also essential to the
Confidence as
practice.
well, because I mean the point is with the evidence base you're talking about, with AI and with Google, actually people can access the evidence base pretty easily, and you've probably seen the same. Actually, patients come into my room very well informed now. It's not that they can't find the side effects and figure out what to do with the medications, but to extrapolate that, and ultimately the reason someone would pay to come and see me or to come and see me in the public sector is for my experience and to help make sense of the information. If you can say to someone, my experience as a clinician, physician, is that I think this medicine, there are some risks. Here are the risks, but actually, here are the potential benefits for you. And I have seen other patients in your situation do really well on this medication. I think you can keep things true, you can keep things according to the evidence, but you can change the framing of that conversation. And from my personal experience, you can significantly improve patient outcomes.
So glad you shared that. And I guess it kind of gets at my final question. But I know we can't get into the details on the business side because there's, lots of details there as well as some confidentiality. But I'd love to know something that you just kind of got into, which is it is private, which implies that patients do have to pay for it. And so that automatically brings up for me the thought of, so how do we make sure that it's affordable long term for patients? And what you were simply just implying in your answer right now, which is the value that people perceive, which is why they come to you. So how do you ensure that they're getting that value? And again, what are your thoughts about how to make something like this sustainable, both for you as a clinic, for your physicians, as well as for your patients?
There's two really big questions there. And in terms of sustainability, I think that's a difficult one because I'm very early on my clinic's only 3 years old. And generally speaking, because we're a private clinic, we do have to be careful about pricing ourselves appropriately to ensure that we're profitable, or costs. So, I mean, generally speaking, we set our prices, and if people can use the clinic, then they do, and if they can't, then they don't. And it's kind of as simple as that. Or if they want to use us, we do have lots of people who use us once or twice for minor things, and then they also interact with the public system as well. So affordability and sustainability. I mean, in the UK, I think one of the problems is that doctors and healthcare professionals are really poorly trained in business. So, especially in the public sector, you're not thinking about the cost of tests when you're ordering them, or the costs of referrals or ongoing care. Whereas in the private sector, we actually do have to think about that, and we have to discuss those costs with the patients. But in terms of sustainability, look, there are many different models. In the pre-interview, we discussed kind of concierge care. There are private clinics in London offering video only appointments for kind of $30 a piece, and I have no idea about the quality, but they may be offering similar levels of value and compassion as well. So I think probably each business is going to have to find its own area in the market in terms of the patients that it's going to able to engage on a long-term basis. On value, for me, the my philosophy is providing outsized value. So whatever people are paying for appointments with us, there's a certain expectation of what they're going to get. So they're going to get, a same-day appointment, a good, a nice environment, a good clinician. But for me, it's about all the stuff that they get on top of that. So one of the things that I love is that we have a standard operating procedure of getting pathology results back to patients immediately. As soon as they come in, I expect the clinicians, as within their reason, to get pathology results back to patients, because most people expect to hear back with their pathology results in 5 days or a week. And if you look through the Google reviews on our website, you see that actually so many people have commented on, great experience at the clinic, and I couldn't believe that I received my pathology results same day or the next day. And so providing that outsized value for me is how we are sustainably growing the service.
You said a couple questions ago that this is simple, that you can practice it in any of the models, the public system, the private system, but the compassion is simple. And then you told us previously, I think it was in the pre-interview, that there are benefits. One of the most interesting to me was reducing the cognitive load on the physician, because they know these patients, so it doesn't take as much for them to go back and do the research anytime they have something new, because they have so many patients. So if you're convincing somebody, if it's simple, what are those 5 things, or how do you do it? How do we make this happen? Where do they start? Because everybody needs that hope to know that there's a next step that they can take to live this life where they are satisfied with their work as a physician, and know that they're giving their patients that care that they need.
Number one, start with customer service. Whatever position you are, whatever you're doing, customer service. Number 2, listen. And number 3, listen in your interactions. And number 3, which is connected, is make people feel like they're cared for. So if you have seen someone who's feeling a little bit low, and you've referred them to talking therapy, and you get their report back from the talking therapist, send them an email just to check in. It takes a minute of your time, and I mean a genuine email. I don't mean via a CRM system. I mean send them a genuine email saying, "Hey, I saw you checked in with a psychologist. I'm really pleased. Let me know how you're doing, or if you want to come in for a follow-up appointment." I think those are probably the 3 biggest ones for me. But it all starts with customer service, and I think as physicians, broadening your thinking around customer service is not a dirty word in healthcare. It doesn't mean doing what people want. It doesn't mean that if someone comes in demanding a certain scan that you have to do it. It means providing people with positive interactions with your business in the same way that you would enjoy a positive interaction with another business.
I love that. Thank you so much for being here and sharing the world that you live in, that we don't talk in much. We don't usually talk about healthcare in the UK. So thank you. We
You're
appreciate
very
it.
welcome. Thank you for the invitation.
This was fantastic. Thank you, Daniel.
You're welcome, Puv. Nice to meet you.
And thank you all for watching. We'll talk to you soon. Bye-bye.